main issue for entrepreneurs trying to break into the NHS is understanding the rules of the game that they're playing. There are some very fundamental ground rules, and anyone who's worked inside the system, not from a clinical perspective, but more from a management perspective, understands the methodologies that are required to break through how they can buy something. A clinician might well support something, but if they don't understand how to sell it in themselves, they struggle just as much as the layperson or entrepreneur on the map. What's really important to understand are things like supply-induced demand, the idea that when you treat one person, there's always going to be room for another person behind them. If you treat them quicker, you have an implied cost of the extra person you could treat that you now have to pay for as well. And there's that sort of accounting that needs to be understood. There are things about the way we deal with prevention. There's a lot of proof that prevention is definitely better than cure, but the managing to show and demonstrate savings in the long term around prevention is very difficult. We need to understand the language of talking about prevention in terms of saved A&E visits, the reduced use of drugs. The long-term benefits are very rarely taken into account with a lot of these different decisions that are made around interventions, and many digital tools do sell themselves in as preventative tools but don't really have the wherewithal to understand what they need to be articulating and focusing on when they're messaging. I think it's also important to understand when you are tackling the NHS, it's a marketplace and not a market. There's no one buyer for your product. There are 190 different commissioning groups who buy product separately. There are 150 different hospital trusts who buy separately, and every one of those has a different cycling time. Within 3 years they could be anywhere. They don't talk to their neighbours about commissioning together, and it's becoming very difficult to scale, because the same discussion that you had with the first organisation you speak to will need to be had again from scratch with the second organisation, and it can take you years and years and years. And that's the reason why the number of 17 years to take a innovation from its initial idea to scale is the estimate that it takes to get across the NHS.